This is Counterpoint, and I'm your host, Tanya Granick-Allen. A recent report by secondstreet.org, based on a poll conducted by Leger, suggests that introducing comprehensive private health insurance in Canada could significantly bolster the healthcare sector. The poll reveals that 48% of Canadians are interested in learning more about or purchasing private health insurance, with 32% willing to pay current market rates. If implemented, this shift could expand the healthcare market by an estimated $21 billion and create approximately 39,000 new jobs. Currently, Canada is unique among the developed nations in prohibiting patients from obtaining comprehensive private health insurance for medically necessary procedures, which places an additional strain on the public system. Allowing private options could alleviate this pressure, reducing wait times and enhance quality overall of care. It seems reasonable. So why doesn't Canada allow private health insurance? How does it work in other countries like France or the UK or Sweden, which offer citizens the choice between public and private care? Well, joining me now to dive into the latest research is Harrison Fleming, secondstreet.org's Legislative and Policy Director. Harrison, thank you so much for joining me today. I appreciate your time.
Thanks so much for having me on this morning.
So very interesting research, and I know I've had folks on for usually call in from Second Street, and where we're diving into private healthcare and what's wrong with the healthcare. But this is interesting. So why don't you unpack your research with this poll for us?
Right. So this follows what Second Street has been working on for a couple of years now, which is gauging sort of public support in Canada for meaningful health reform. And what this report specifically looked at was finding out a big difference between Canada and some of our international peers. And that's right now, Canada is a total outlier. We look at almost every other country in the world that offers some sort of government-run universal healthcare system. All of those countries do something a little bit differently than Canada, which is they allow patients the choice of using that universal publicly accessible healthcare system or going down the route of getting their own private health insurance or care through alternative providers. And so what this report really did was looking at what would happen if we were to implement a policy like that in Canada, if we were to give Canadian patients a choice. Would there be interest? Would the overwhelming majority of people just stick with the government system, or what would happen? And so what we saw is actually about half of Canadians are expressing interest in some sort of additional coverage for healthcare to get services that either the government is unable to provide in a timely fashion, or otherwise to meet their medical needs. And so when we're looking at that number, nearly half of Canadians say that they're interested in looking into this. And then breaking that number down a little bit more, we have about a third of Canadians who actually today, looking at current market rates, say, yeah, absolutely, we'd be interested, we'd buy this today. And so that's the number that we use to project a national market on.
And that's quite a high number. Like one third clearly have some level of, to me, that says that they have a level of dissatisfaction, probably significant dissatisfaction with our current healthcare system. That's not good, especially if you have no choice. So that's very interesting. So why don't we, just before we delve into further details, explain how private insurance would work? Because again, many Canadians watching this show tonight were born into a socialized healthcare system and never knew of any other option. We just know about this, quagmire in the United States of whatever they do and alleged cash registers at hospitals, which we know isn't true, but you know what I mean. So what does private health insurance look like?
Right. And thank you for asking. It's a very important question because right now, there's just simply no choice. And so what private health insurance does is says you as a patient can still absolutely rely on a universally accessible, publicly funded healthcare system. But as we all know, those systems run into headwinds, whether it's wait times, whether it's accessibility issues. So frankly, every other country in the world that has a system like ours has said patients can now pay a little bit out of pocket every month to essentially buy an additional level of insurance. Now, we see that in Canada already with something like Blue Cross, which your employer might pay for to say if you need extended medical benefits for something like glasses or prescription medication. So we have companies that already pay for a little bit of extra insurance that right now is outside of the healthcare system. What we're saying is expand that to allow people to buy procedures that are not just, prescription medication or eyeglasses, but actual important things like a knee replacement or something like that.
Right, right. Because the wait lists are long and some people just want to pay. We're going to unpack more of this report when we return from this commercial break. Please stick around.